Hi there, folks. This is Dr. Ellenburg. Welcome to another hour of medical news and information you can learn and apply to your health in a variety of ways, hopefully. As usual, we'll be on for the next hour here on Hot Talk KOAN, FM 95.5, and of course, 1080 AM. You got questions today about your health, give me a call here. It's 569-1080, 569-1080. So reminder before we start with the rest of today's show, you will find me during the week at the Ellenburg Center for Natural Medicine. Our phone number there is 563-2366. Our website address is drellenburg.com, and that's DRELLENBURG, drellenburg.com. Check us out. I am working on currently getting set up. We have a YouTube channel put together for myself, and we're going to begin adding archived radio shows to the website, to YouTube specifically, on that particular channel, and you'll be able to listen to that online as well. Of course, it'll all be recorded, but nonetheless, you can hear shows you may have missed in the past. And again, some reminders, too, this show is re-aired on Saturdays from 10 to 11 right here on Hot Talk KOAN. And then on Sundays, it is aired on KVNT. That's 92.5 FM or 1020 AM. All right, and again, another reminder, I do see patients in the Kenai and Soldotna areas. Give our office a call at 563-2366 for times and dates. All righty. Well, plenty to discuss here today. And again, some reminders, your questions about your health or medicine in general. It's an open topic, our discussion here. Give us a call at 569-1080. It's 569-1080. Okay, well, let's get started today. We're going to discuss ADHD today. We're going to talk about some chemicals that can affect your body in a variety of ways from our friends at Environment Working Group. They put together a new little top 12 chemical disruptors in our bodies that can affect our hormonal systems. We'll also today be talking about, we'll skip that one, go to this one here, talking about probiotics on IBS, otherwise known as Irritable Bowel Syndrome. And we'll also be talking today about chronic fatigue syndrome as well. And we will end things off talking about cardiovascular disease in relations to blood pressure changes over a period of time. And we'll see how far it gets us. Okay. Well, right off the bat, a very interesting study that appeared in the journal this was from here. I want to say the British Journal of Psychiatry, published last month. And it is looking at micronutrient supplementation was shown in this particular study to ease adult ADHD, or attention deficit hyperactivity disorder, and these micronutrient supplements also boosted mood. And what was done, and this was done in New Zealand, and they used they call it a micronutrient formula. Basically, it was a multivitamin mineral from a company called EM Power Plus. I pulled up their site online and checked out their nutrients. You know, it's not a bad-looking multivitamin mineral. There are, I would say, many like it that are in existence besides just these folks, but in this case, this particular product was chosen. I think it's from Australia specifically. And people were put on this. It has, first of all, what's in it? Well, it has 36 ingredients, so 14 vitamins, 16 minerals, 3 types of amino acids, and 3 antioxidants. And it's made by True Hope Nutritional Support Company. And the study involved 80 adults who all were diagnosed with ADHD, but were being untreated. And so for 2 months, 42 of those adults took the supplement, 15 capsules per day. That's quite a few. And then a matching, basically 38 took a placebo. And those who were taking the micronutrient formulation reported greater improvement in both their inattention and their hyperactivity and impulsivity compared to those who were taking placebo. And some post-analysis, there were a number of the folks with ADHD that had moderate to severe depression at baseline, and they actually had improvement in their mood change while they were taking these micronutrients, as they're calling them in this particular study. And, you know, this is something that really isn't surprising if you start thinking about the way that people can be helped with ADHD. You know, some of the main ways that are out there, people are being put on some type of Ritalin-type prescription. There's quite a few out these days for children, but one area in particular that we can always look more at is nutrition and what could be some organic causes of ADHD. And certainly, if people are deficient in minerals, that can also play an effect on your brain health. It's interesting that the study took place in New Zealand. If they're taking about 15 of these pills a day, I think the serving size is 3, that there was some kind of a dose of vitamin D that's somewhere, I think it's between 2,000 and 3,000 international units a day. People in New Zealand, just like people in Alaska, are going to be prone to being vitamin D deficient. So one alone, based on the study, we could suggest that people were having their vitamin D levels at least improved upon, even though they were on a very low dose. But that was able to affect their mood. And when people see me for ADHD, I'm a big fan of looking at, well, how's your thyroid function? What is your vitamin D status? What are you eating in general as far as food? What is in children? How much activity they have with computer. Well, this I guess is called Xboxes and playing video games or calling them. That's the old name for them. But how much media exposure are they having? All those things tend to play a factor. And certainly with sleep is another reason to play a huge factor in a lot of people as well. If you don't sleep well, it's probably pretty hard to pay attention and think properly as well. Other piece that I am looking at more these days than ever before is people's diets, and specifically, do they have any food intolerances? Not necessarily allergies, but they could have hidden allergies with some of their foods. But we do know out of 2 studies last year that I talked about here in a radio show that specifically food allergies or food intolerances have been linked to causing ADHD, because you're actually having excitatory signals being sent to the brain via these different types of food intolerances, eventually making it across to your gastrointestinal tract into your blood supply and affecting parts of your brain. So, when somebody has ADHD these days, typically they're being put on some type of medication very, very often. Well, one way to consider this is that your brain isn't deficient in this prescription drug you're being put on for this. There are real causes as to why somebody has ADHD or ADD for that matter. And they need to be eliminated, or at least looked at to rule them out, at least, or rule them in as being causes of this, versus just saying, hey, take this drug, and while you're in school, when you get out, you stop taking it. And they have their own side effects, and some of those drugs in particular cause insomnia in some patients. But, this is a very simple study that had a very simple intervention, and that was putting people on a multivitamin mineral and seeing what type of effect it might actually have on their brain function. And for this case, many people, and these were all adults, these weren't children, had major improvement while taking the multivitamin mineral specifically. So very interesting. They're going to be recruiting 100 children for a study they're going to do on children age 8 to 12 and see whether micronutrients may be helpful in reducing their ADHD symptoms in comparison with those who do not do that. So, good study. I probably would put some money on vitamin D playing a big factor into why those results are the way they are. And again, as a reminder for you folks out there, if you are taking vitamin D, if you do suffer from like seasonal affective disorder or ADHD or mild to moderate depression, it'd be very important for you specifically to get a blood test done to see where your vitamin D levels are at to begin with, because you may be taking inferior levels of vitamin D3 that won't move your vitamin D3 levels in your body very far. And remember, we're here in Alaska. There is no vitamin D from the sun at all right now. I don't mean you can go out today. It's not very warm here in Anchorage, but if you were to strip down into your skivvies, you're not going to get any vitamin D production in your skin whatsoever. And the reason that is remember, ultraviolet B rays from the sun are absorbed by the ozone layer a good portion of the year here in Alaska. So usually around May to about the first part of September is the best time to get vitamin D3 from the sun. And you have to have direct sun exposure. Sitting behind a sunny glass window in the middle of summer, you're not getting a lick of vitamin D. You've got to be a direct sun exposure. Somebody asked that a while back, so I just want to mention on that one too. And as always, you can visit some more information about learning more about vitamin D at vitamindcouncil.org online. It's a great website. All righty, we'll move on here forward. Questions today about your health. This is the time to call 569-1080. It's 569-1080. Listen to Hot Talk KOAN 95.5 FM AM 1080. Again, our phone number here is 569-1080. And again, you can also find us online at 1080KOAN.com. You can live stream us from wherever you're at in Alaska, or for that matter in the world. Listen to us. Okay, well, once again, our friends at the Environmental Working Group, and I call them our friends because they really put forth some good information, publicly trying to help us out and learn more about what out in the environment can affect your health. And I frequently get asked, well, what my environment? Well, your environment is anywhere you sleep, breathe, or live. So it could be work, it could be your car, or it could be your house. It's going to be anywhere you exist. That is your environment these days. There's not some other place to be exposed to various things, because it's pretty much everywhere as far as your exposure possibilities. And the new section they're discussing here on EWG site, EWG.org, you can find them online, Environmental Working Group, is looking at some of the top 12 chemicals that can affect your hormones in your body. The fancier name for these type of chemicals can also be called endocrine disrupting chemicals. And they disrupt your hormonal system in a variety of ways, depending on the type of chemical that it is and what it looks like in a sense that your body is used to seeing, but not quite the same. So the chemical structure is different than your standard, say, hormones in your body, but it's a little bit similar, and yet can get in there and disrupt the way your hormones actually work. One of these has been talked about for several years, and over the years on the radio show here and other places, I've discussed talking about BPA, otherwise known as bisphenol A. That's heavily found in a lot of plastics. And we do know that they do disrupt our hormones to some degree. They have been linked in a couple of different studies to breast and other types of cancers, obesity, possibly early puberty, and heart disease. And they mention here on the BPA piece here from the Environmental Working Group that about 93% of all Americans have BPA in their bodies. And it's not just something you find in plastics. If you eat canned food, which a lot of people do, they're lined with BPA, and they're lined because it helps the food literally slide out of the can easier. That's why it's there. It has no other really good function. And they're also found in things like thermal paper on receipts when you use your debit or credit card, and also found in a fair amount of plastics. Now, not every plastic contains BPA or bisphenol A, but many of them do. So you want to be smart about your exposure to this. One of the arguments on BPA not being a problem is that the fact that, it doesn't stay in your body very long and you can get it out. Well, the point is, if you are exposed to BPA through a variety of food you're eating or a water bottle you drink out of, for example, on long term, this is what we're talking about. This is long-term exposure. One-time exposure to BPA isn't going to cause you to have, heart disease or obesity. It's the long-term exposures that can increase the risk of that actually happening. Let's hop down to a few other ones here. I'm not going to read all these off today, but there's a few of them. Another one, too, speaking of plastics, is phthalates. Phthalates are, again, found in all types of plastics. And they actually have the ability to disrupt, again, hormonal changes. We're talking about endocrine disrupting chemicals, or EDCs in this case. Phthalates, just discuss bisphenol A, another plasticizer. But phthalates have also been known to affect the male reproductive system, and there are some links to obesity, diabetes, and some thyroid irregularities as well with plastics. Again, how do you avoid that? Well, you'd be looking at a good place to start is avoid plastic food containers. Even children's toys can have this kind of stuff in it as well. Even some personal care products. And one thing that EWG.org has on their website, which is free, by the way, to look at, is their Skin Deep database, which looks at a variety of things applied to our skin, from makeup for the ladies to suntan lotions to sunblockers to skin creams. And you can look for phthalate-free personal care products with their website. There's even an app you can download for nothing on your phone if you really get serious about it. But check out EWG.org. They have their section on their site is called Skin Deep Database. You can check that out as well. What else do we have on here? One of my big topics here is looking at lead, for example. We don't tend to think about lead as having a whole lot of hormonal issues, causing hormonal issues in the body, but it can. We do know that exposure to lead in a variety of ways can lower your IQ, can cause hearing loss, it can cause a premature birth, it can affect your blood pressure and cause cardiovascular disease, affect your kidneys and your nervous system. And this is not everything, this is a few of them. But the other way is that it can literally, has been shown in animal studies, this is lead again, to lower levels of sex hormone levels in animals. And, that can disrupt a variety of things inside your body as well, concerning fertility issues, menopause, and even andropause in men, for example. And many of us think, well, they haven't used lead for a long time in the environment. Who cares? Well, if you live in a house that's, 1980 or earlier, there is definitely lead in your home. Lead was used in paints until 1978, and it can still be found in the dust of many homes, especially in the Anchorage area. If you're testing your dust samples, you actually can find lead. Biggest thing is how to avoid that. Well, one is taking care of paint, and if you are doing major renovations in your home, when your home was older than 1978, there's going to be lead exposure to people in the home. There's work being done, so be aware of that. Water-wise, we haven't seen a whole lot of lead typically show up in water systems here in Alaska. Naturally, it tends to be a result of plumbing, and especially if you have older plumbing using copper tubing with solderings that tends to hook those pipes together. Those can contain lead, and that can be pulled into the pipes over a period of time as well. So it's important to realize you can be exposed to it any number of ways that you wouldn't think about. Another thing to consider, we don't talk much about on this show at times, is pesticides. A couple weeks ago, Dr. Thompson was on our site talking about glyphosate, which is a type of organophosphate pesticide that is used regularly on a lot of things, especially in Roundup specifically. But we have a lot of exposure to pesticides that we're exposed to from our food. Even if you're buying, vegetables or fruit that have low levels of pesticides on them, it's still worth your while to pay attention to this, because it will affect your long-term health. Literally washing your fruit and vegetables is a good idea. I don't mean with water. I mean literally, actually taking some, like if you did an experiment at home. So you've got a tomato, and you just rinse it off. Then you get a tomato, and you rinse it off and put some soap on it. Literally put soap on the tomato. Rub it for just a little bit, say less than half a minute or so. Rinse it off, and you literally can feel the difference in the texture by touching the tomato that was not washed in soap and the one that was. And the reason it's changing, for one reason, is you're taking off this layer of pesticides that's like coated on the outside of these tomatoes, for example, and breaking it down. There's other ways of doing this as well. There's one way of doing it on your own. So, again, Environmental Working Group's site, EWG.org site, you can find the Dirty Dozen and the Best Dozen. And what this looks at is organic versus non-organic fruits and vegetables, and listing out that, hey, if you can't buy organic, you want to buy these organically because they have a lot of pesticides used in them, or they don't, and therefore if you can't buy organic, better choice, you can choose these and feel fairly good the fact there's not too many pesticides on that particular type of fruit or vegetable. And again, you can find it on their site at EWG.org site. Very good information on that one as well. They've had that for a number of years, so it's been updated. And there's some reminders too, on apples, for example. They're the most heavily pesticide-laden fruit out there. So it's worth spending that extra money on an organic apple versus not getting organic. Okay, let's move on from that topic. But again, you can read more about these different chemicals known as endocrine disrupting chemicals on EWG's site this month online. Again, it's Environmental Working Group, and their site online is EWG.org. Okay, we got about 5 minutes to the bottom of the hour break. If you have questions about your health, now's a good time to call. Our number here is 569-1080. It's 569-1080. I wanted to comment on not so much this particular study, but it brings up an interesting issue in looking at people on low-fat diets. So there was a study that appeared in the Journal of Menopause looking at the use of low-fat diets on serum lipids, things like cholesterol, triglycerides. And this low-fat diet was looked at in women who were premenopausal and women who were postmenopausal women. And they were trying to evaluate the effects of a low-fat diet in comparison with a usual diet, and looking at the different types of cholesterol and triglycerides a woman might have who's premenopausal or postmenopausal. Now, it's a meta-analysis, which that means is they go through a bunch of old data, put together in a big study, and call it a new study, basically. And from these huge databases out there, they chose 8 randomized clinical trials, which included over 22 groups. So in the end, there was about 1,500 women who were in the study, and 900 were in the intervention group. The intervention group in this study specifically was put on a low-fat diet, and they wanted to see what type of effect that had on total cholesterol, HDL, and LDL. And of course, people on low-fat diets had a greater, more favorable change in total cholesterol, HDL, and LDL than those who were not on low-fat diets. Now, the reality behind this, doing this long-term, being on a low-fat diet, is the issue that I want to bring up that nobody in this study brings up at all. And a reminder of that is, it's quite interesting if you were putting somebody who's premenopausal or postmenopausal on a low-fat diet, and what effect that's going to have on their sex hormones. Because when you're in the state of being, premenopausal or postmenopausal, particularly postmenopausal, your hormone production levels of estrogens and progesterone are now diminished because your ovaries are no longer making it like they used to. If you have ovaries still, and you're premenopausal or postmenopausal, you're still making some hormone from your ovaries, just not as much as you used to. And the backup to that's going to be your adrenal glands. And your adrenal glands make hormones from cholesterol. So what I'm getting at here is that if someone's put on a low cholesterol diet, so in this case low-fat diet, over the long term, you might actually see a higher increase or a susceptibility to having, hot flashes and insomnia and a variety of other things that can show up with women who are menopausal or even postmenopausal. So, one thing that the diet by the American Heart Association has shown is that the suggestion for years of a low-fat diet actually ends up being a big problem in the end, because people are taking out all the fats, not just the bad fats. And that's where the rubber meets the road right there, is if you're on a low-fat diet, you're going to be missing out on fats that actually are very, very healthy for you. Some reminders again, your cholesterol, for example, is involved in helping your body make all your sex hormones. It's heavily involved in that. Cholesterol is involved in every single cell layer in your body. Certain types of fats in your body are involved in creating an anti-inflammatory environment versus a pro-inflammatory environment. A good portion of your brain is made up of fat. So if someone ends up going on these type of low-fat diets for the long term, you're probably in the end going to end up with some long-term consequences that don't bode well for your future health. Maybe for the short term, they'll do great because they lower your total cholesterol and triglycerides, but the long term, they could have major, major effects if you're not being careful the type of fats you're actually eating. That's the key. And if you're eating these healthy fats, now we got a different story. So it's important to understand that and looking at low-fat diets and suggesting that, you could lower your fat intake from trans fats and saturated fats, but focusing on things like omega-3 and omega-6 fatty acid supplementation via your food is a great way to consider that. What are good fats, for example? Things like, almond butter, olive oil. Even though coconut oil is a saturated fat, it can be very healthy for your body. So that's the one's a little bit different. But there's a sign that we have to go to our bottom of the hour break. We'll be back in a few minutes. Hang in there.
Sunshine came softly through my window today. Could have tripped out easy, but I've changed my way. It'll take time, I know it, but in a while you're gonna be mine, I know it.
Hi there, folks. This is Dr. Ellenburg. Welcome back to part 2 of our medical show here on Hot Talk KON, FM 95.5, AM 1080. You got questions today about your health, give us a call here, 569-1080, 569-1080. And again, you can find us online as well and live stream us at 1080kon.com. Alrighty, well, before the break, we were just finishing up talking about low-fat diets and why they're probably not the best thing for you to do long-term. Let's switch gears and talk about my favorite topic these days, which is a healthy little, or could be healthy little guys in your GI tract known as probiotics. And slowly but surely, probiotics are becoming more of a term we're used to hearing about, but they really describe a huge conglomerate, basically, in the sense of all these different types of bacteria found in your gastrointestinal tract. Some mostly good, some bad, but an environment nonetheless down there that is starting to be linked to looking at things like type 2 diabetes, autoimmune disease, cancer. And a lot of those studies have looked at what are the different types of bacteria that are more predominant in those people with those types of conditions. And they're finding out that people who don't have those conditions have a markedly different type of bacterial makeup down there in the old gastrointestinal tract. So we're going to hear a lot more about this as the years go forward. It's pretty interesting to what degree, because, certainly probiotics these days, yes, they can be expensive, but I mean, it's not something, again, you really can patent, because you're taking bugs and growing them based on what we know is, or hopefully what we know, is found inside our gastrointestinal tracts. But it's amazing the number of different journals you will tend to see an article now posting on about probiotics. So it's nice, because for one, you can't patent it, so there's not a lot of money in it. But it doesn't matter. We're actually hearing a lot more about this in a wide variety of different medical journals. And this particular article is looking at the use of what they call multi-species probiotics, and that would mean that when you turn that bottle around of probiotics you have in your hand, if you have one or you bought one, there's more than one type of bacteria in there. Frequent ones you would find in the store would be things like Lactobacillus acidophilus, along with things like Bifidobacterium bifidum or lactis, very common ones that are found these days. But there are a wide variety of different types of species that can be put into a probiotic formula to be used to treat an array of gastrointestinal problems. This particular one is looking at irritable bowel syndrome, which is a problem that affects a fair number of people. It really didn't become a well-known thing until they invented Zelnorm here several years ago to treat IBS, because, of course, they're deficient in Zelnorm, and that's what's wrong with them. I'm just making a joke there, folks. Of course, they're deficient in Zelnorm. But, when somebody has this IBS, they're plagued with, constipation or diarrhea. There can be a lot of dysfunction in the GI tract, and many of them have altered bacterial environments inside the gastrointestinal tract. And these are not patients that are being diagnosed with, say, Crohn's disease or ulcerative colitis. They're being diagnosed with this kind of like, well, we're not quite sure what they got. They don't have these two things, so we'll call it IBS or irritable bowel syndrome for lack of a better term. The reality is that, people could be having irritable bowel syndrome because they have, food intolerances, not food allergies or low-grade allergies. But, they could have allergies that they don't even know about, because they can eat food day in, day out and not really experience much that happens after they eat. But later on, the GI tract feels kind of weird, or they get cramp, they got gas, or they just don't feel right. That's what a food intolerance could actually feel like in these patients. And, when someone walks in my door and says, I've got IBS, the first thing I'm thinking about is they need to do a diet modification for a period of time and see if they feel any better. It's a very simple intervention. It is not easy for most people to do, because they're very attached to the food they eat. When I tell patients these days to consider getting off of gluten, you think I was telling them to cut off part of their right hand or something, because it's such an attachment to eating certain types of food. And what I chose to do over the last 2 years ago was, well, I'll go gluten-free, okay? If I'm telling folks, let's do this, let me try it out, see what I find out. And what I find out is that when I don't eat gluten regularly, my GI tract just feels better. And when I start eating gluten, like I'll have something one day and something the next, I just don't feel right. I might even get heartburn, which I never get heartburn. Take out the gluten, no heartburn. Sometimes it's that simple. Other ones, it may not be that simple, but eliminating foods for a period of time, certain food types specifically for a period of time, make a huge difference. Like someone who has asthma, for example. If you have asthma that's pretty severe and you consume dairy on a regular basis, you should try to get off dairy for a month and see how your symptoms are. Respiratory-wise, see if you have less shortness of breath, or use your inhaler less, or use your breakthrough inhaler less. You might be very, very surprised at what not eating dairy would do, because I did this when I was 20, and it made a giant difference on my asthma, big time. So back to our friends here in the study. looking at the use of multi-species probiotics in irritable bowel syndrome, appeared in the Journal of Gastroenterology and Hepatology. So hepatology is a study of liver disease, and so there are people who are called hepatologists who tend to be specialists within their own field of gastroenterology, just to help you out. So GI docs. And the aim of this study was to look at using a multi-species probiotic formulation in 50 IBS patients who were diagnosed according to the following criteria set forth. They call a Rome 3 criteria, which they had certain things they met as far as their symptoms of IBS. And patients were assigned in 2 random groups, one to receive probiotics, one to not. And they received a mixture of different types of Bifidobacterium. There were 3 types of that. And Lactobacillus acidophilus was in there, as well as Lactobacillus rhamnos. And the last one is a fun one, is Streptococcus thermophilus. So a different blend of things was put together, and they took these twice a day for 4 weeks, or received the placebo twice a day for 4 weeks. And the primary endpoint in the study was looking at substantial changes in abdominal symptoms. And most people at 1 month in, so halfway through the study, were substantially relieved at week 4. There was also looking at other endpoints such as abdominal pain, discomfort, bloating, how frequently they had a bowel movement, was the consistency of it, was it loose, was it hard, was it constipated, and also looking at different types of the microflora. And they actually looked at different stool samples out of these people in the study prior to the study and afterwards to look at things. And as I mentioned already, by week 4, 68% versus 38% the folks in the placebo group getting nothing, 68% were better, 17 out of 25, versus the 40% who were better in the other group. Beyond that, the fecal analysis, which was done on stool samples, revealed that that the levels of these various bacteria found within the probiotic multi-species product had increased dramatically and after 4 weeks. So basically the answer to this one is, a multi-species type probiotic supplementation means different types of bacteria was effective in the patients with IBS, and also on the actual microflora environment was also effective. They actually got into them and did something. And not every single probiotic supplement out there on the market is going to do this. Many of the products are inferior, are manufacturing problems, and for a lot of patients, they don't take enough. In this particular study, the doses were around, last night they had a kind of odd way they figured it out, but it was maybe around 30 billion at the most that people were taking in a day. And you can go out there and buy products right off the shelf in health food stores and see them at 1 billion. And the biggest problem I mentioned frequently about the use of probiotics is that a lot of people just don't take enough of them. I'm not saying you should take, 1 trillion, CFUs of some type of probiotic species, but taking 1 million is kind of a joke. It's like, even working with yogurt. I mean, yogurt tends to have maybe a couple of million bacteria in there, and for people who've got real problems, that yogurt's not going to cut it. If you're doing it for maintenance and support, that's a different story, but not for any kind of treatment of any kind. So it's really important to consider that and looking at. And the other part I want to bring up that I have a lot of my own patients do is that when we put them on probiotics, we may have ones that we actually sell out of our practice. What we do next is, once they finish with ours, is have them move on to different brands of different companies with different strains of bacteria. And have them do that way as well, to introduce different things, see what might happen inside that GI tract. Because, of the trillion or more bacteria that are there, we haven't identified even close to all of them. And it isn't like someone's deficient in these types of probiotics, but it's a fact that taking probiotics can trigger a environmental change literally within the GI tract that can help improve someone's gastrointestinal health and affect their immune system. We know that already. So it's really a big deal. And it's important to realize that in people with different types of disease conditions that involve their GI tract, they're in a different place, And why are they this way? Well, a lot of people, if you weren't breastfed or if you weren't didn't come out of the world naturally from your mother, it was a C-section, you may have missed out on proper bacterial exposure in your early days of life. And furthermore, if you end up being on lots of antibiotics later in life because of various infections, you're getting your GI tract hammered by those antibiotics. I mean, just taking out things right and left. A lot of people can develop some very debilitating gastrointestinal problems because they were on antibiotic for so long. So there's a lot of downsides to being on long-term antibiotic care that can result from it, unfortunately. Though if it can save your life, well, what's the downside then if you're septic? But there's a point in time when to use them and not to use them. That's the biggest thing. And we're starting to finally see some better changes about that. You know, less kids taking taking antibiotics as often as they've been prescribed in the past. Because certainly for many years there's been an instance for doctors typically to give a lot more antibiotics than might be needed. And I'm not just saying that. This is coming from places like the CDC saying exactly the same thing. So I'm not making that kind of stuff up. That's real data that comes out there. But the CDC had an article on this. I think we discussed it here on the show a few months ago about what suggestions going forward in the use of antibiotics in the U.S. population and things we need to be looking at. And that is using them when they're exactly needed, using the right ones when they're needed, because we actually do testing to find out what type of bacteria the patient has and what might that type be, what antibiotic might be used to treat that certain type of bacterial infection. That's the key part too, again. So we're seeing changes in that direction, which is a great thing. All right, folks, get us to Dr. Michael Ellenburg. It's our medical show here on Hot Talk KOAN, FM 95.5, AM 1080. You can find us online at 1080koan.com. That's 1080koan.com. Our phone number here at the station is 569-1080. It's 569-1080. Questions about your health or about our topics, give me a call. We've got about 12 minutes left in today's show. It'll be good to chat to you while we have time to talk. All right. Well, let's actually come back to that one. And very interesting study looking at blood pressure. So in your blood pressure, you have two numbers, right? So systolic is the top number. The bottom number is diastolic. And one thing that's heavily discussed in medicine of any type is, treatment of people who have, high blood pressure or borderline. In this case, things like hypertension means you're already there. What if you're pre-hypertensive for a number of years? What have we seen? And this study that appeared in the Journal of the American Medical Association this month looks at some of the data from the coronary artery risk development in young adults, also known as CARDIA, coronary artery risk development in young adults. And the analysis looked at about 4,700 men and women, and most of the folks in the study were aged between 18 and 30 years, and they recruited from U.S. cities in 1985 and 1986, and they were followed for 25 years. Now, that's a study. Blood pressure measurements were taken at the beginning of the study at 2.5, 7, 10, 15, 20, and 25 years. And they looked at people with different types of, as they call it, distinct blood pressure trajectories in the direction they were going. You had people who were low and still stable blood pressure, those who had moderately elevated blood pressure but were stable over time, those who were mildly elevated but increasing blood pressure over time. Of course, we keep going to the worst, and that is elevated but stable blood pressure, and elevated and increasing blood pressure was about 5% of the folks in the study. The majority were kind of hanging around these folks that had moderately high blood pressure but were stable over time. But each group did experience a small and steady increase in both the numbers, systolic and diastolic. And the main outcome was a measurement of analysis at around 25 years of what I've talked before here in a show about, which is a calcium score test. It looks at hard calcified plaques in the arteries of your heart. And they were looking at that anybody who had a score over 100, it tends to increase your risk for future coronary events in your heart. And the coronary arteries of your heart is what supplies blood supply to your heart, and that's what can get blocked and lead to heart attacks and angina or chest pain. And as the blood pressure groups increase, they had a greater or higher, frequently a higher number on their calcium score test, which is a very inexpensive test that can be done at a few different places here in Anchorage, even in Wasilla and also in Soldotna. And it looks at hard calcified plaques in your heart. The test costs about $100 to $150 to do it, but it's probably one of the best tests out there for giving you a general idea. Hey, how's my heart looking for my arteries wise? Are they really plugged up or are they not? And It's a very simple test to be used that can give you a lot of good information from it, and that's called a calcium score test. So that's a CAT scan, but in this case, you don't consume any of the contrast. It takes about 15 seconds to do the test. It's real quick, but it can be very, very helpful. And, you know, this brings us to a kind of a longer discussion in a sense, and that is, you know, your blood pressure. You know, what is a healthy blood pressure? You know, when I was in, you know, naturopathic medical school, and we were being, you know, going through our cardiology, basically classes and a little bit of rotation in a sense through our programs, you know, we were, the cutoff then for someone being hypertensive was anybody who had 140/90 and on the higher end. If you're under that, you're almost there. A few years later, 5 years later, roughly out of our programs, we start seeing recommendations of being around 130/80. So if you're over that, then you are hypertensive. And now you can see it as low as some guidelines suggesting that 120/80. If you're above that, you are pre-hypertensive and need to be treated. You know, there's a lot of reasons why blood pressure can go high. One of the biggest reasons these days taking place is that we have a lot of the population who is pre-diabetic. Not diabetic yet, but pre-diabetic. And you can go on for many years and be pre-diabetic and have high blood pressure as a result, the fact being that you are having trouble with your insulin and glucose levels, so they're being maintained for the interim because your body is able to kind of create this homeostatic type environment to support, you know, keeping glucose under control. But as you become, in a sense, more diabetic but still pre-diabetic, your blood pressure can go up. Your blood pressure can go up because you're low in minerals, which is a common cause for a lot of people, even a lot of cardiac problems, like atrial fibrillation, for example, which can be linked in a lot of patients to a mineral deficiency. It can be corrected frequently with minerals. It can be done. So, getting back to, you know, causes here of high blood pressure. So one we mentioned already is kind of a pre-diabetic state or metabolic syndrome. Mineral status could be depleted. Obviously, stress plays a huge factor in this as well. But you know, if your blood pressure continues to go up over a period of time, it is going to be an issue because it's going to affect flow, and you've got greater, you know, pressure in the pipes. You're going to, in this case, your arteries, you're going to possibly lead to having more troubles in certain parts of your arteries and various parts of your body, including your heart, for that matter. And we by no means have figured out all the causes of why people actually have hardening of the arteries or atherosclerosis, but high blood pressure does not help. So, you know, walking around with a blood pressure range, this is going to be like an ugly one, you know, someone say 190/90 or 80 on a regular basis is not good for you. There's no question about it. I mean, I definitely have my cutoffs, and, you know, if I had my way, I'd see most folks at 140/90 and under. And, you know, we have many that are over that on a regular basis. The other thing that's important to understand, too, when you go see your provider, and it happens a lot in our office as well, they'll come in and it's a new patient, and even after sitting for 10-15 minutes and we'll take their blood pressure, see where they're at, it can be elevated over normal frequently when they're in the office. And so I have many patients actually do some what I call serial measurements at home, where they're taking their blood pressure with their own cuff at about the same time every day, if not twice a day, to give me some more numbers to work off of, and using that as a better gauge of how their blood pressure is doing, because frequently when they're in the office seeing me, they're a bit nervous sometimes. They can be, and that's going to raise your blood pressure up in the first place. But an interesting study, because it's a 25-year study, and I like the fact they looked at the calcium score test as a marker. One thing about the study is about 30% of the patients in the study did not have their calcium score test done. So it takes away from a little bit of the support towards calcium score, but just a little bit. I think it's a very important test. And if you have a family history of cardiovascular disease, a calcium score test would be a great idea to do. I wouldn't recommend doing it at age 20, but maybe sometime in the late 30s or early 40s, is to do something nice for yourself. Most insurance companies, I'm aware of, do not pay for this test, but again, it's fairly inexpensive. A calcium score test can be done somewhere between 100 and 150 in the Anchorage area for sure. Again, the article on blood pressure appeared in the Journal of the American Medical Association this month. Okay, well, we got about 4 minutes left in today's show. If you got a question, you better call right now if you want to get it answered. 569-1080, 569-1080. Run out of time here to finish up today's show. We'll go forward with a little bit of a last topic here. Very interesting. It's a short one, but the headline grabbed me, so I had to bring it up. And it says, a soda a day ups cardiovascular disease risk by 30%. And once again, looking at these National Health and Nutrition Examination Surveys, known as NHANES data, which comes out mostly out of the CDC, was looking at the number of calories that are consumed from sugar. And, American adults on average, it says here, about 15% of the calories are from sugars that are added during food processing, with a whopping 37% of the added sugar in people's diets consumed in sugar-sweetened beverages. And the study basically projects that regular drinking, and you can say as little as one 12-ounce sugary soda a day, may increase your cardiovascular disease risk by 30%. This is why they are a treat soda, not to be had every day. You don't want to increase your risk of these things, and there's sugar in there. I mean, obviously having a Coca-Cola or whatever you drink once in a while is one thing, but people who are consuming several of these things a day, you are increasing your cardiovascular risk dramatically, and your risk of developing type 2 diabetes, obesity, and high blood pressure. And, in these surveys they looked at, basically over the national data, is that a majority of the sugar added in people's caloric intake was beverages. And some were in grain-based desserts, some fruit drinks, some dairy desserts, and candy was at the bottom of the list. In 2005, 2010, most adults in the study consumed 10% or more of the calories from added sugar, and about 10% more consumed 25% or more calories from sugar. So it's an increase, dramatically for that matter. And in this day when heart disease is still the #1 killer in the U.S. for disease, it's important to realize what needs to be looked at in trying to change that number into a smaller number and less people dying from it. And, it may seem simple to say, well, yeah, we're recommending that you change your intake of sugar, and that's going to make all the difference. Well, it can make a huge difference, obviously, along with exercise. It makes a giant difference. And if you're diabetic, you should not even be drinking soda pop at all. Even dietary stuff isn't that good for you in the first place. Diet sodas, because they have aspartame in it, and it's shown to cause a variety of terrible things, including migraines, and in the worst one being cancer. Aspartame studies mostly were done on animals, but the point is we need to have something to look at. So it's not a healthy thing to be doing. So please change that. And again, you're about a month and almost a month and a half into your New Year's resolutions. I hope people out there who made some health-wise are sticking to them, because usually within about a week they're done. So remind yourself what you wanted to do this year for your health. Write it down and remind yourself on a regular basis how you want to change your health. All right, folks, we got to shut down things today here in the show. Next Monday will be a rerun. I'm going to be at a cancer conference, so the following week we'll discuss that. I'll be at a cancer conference over this next weekend, and we'll talk more about that when I get back here in 2 weeks. And of course, 2 weeks you'll find me at the Ellenburg Center for Natural Medicine. Our phone number is 563-2366. Website address is drellenburg.com. Take care, and we'll talk to you in a few weeks.
People in a cool little square, or you can cut it with a boat or a plane. Man, it's gonna take a new train. You'll be leaving on a new train, far away from this world of pain. And when you look out your window, you'll see your home, your baby, and your family. No milk.